For the next release, we're going to be aiming at the adductor complex. It's the region on the inner side of the thighs. The main reason we're going to get into these, well, there's multiple reasons we want to get into this region of the body. One of them has a lot to do with these hip hikes that I've been talking about. And just in general, whenever you're loading these hip hikes, that tends to be very, very taxing on the adductor complex. And again, if we overwork those areas because we're not potentiating the rotations that we need to, the extensions that we need to, we end up putting a great deal of pressure on these adductors. Never mind that, also when we're sitting at the desk for constant hours a day, the adductors also happen to be part of the hip flexor complex as well, especially if you see how they relate to other parts of the anatomy upstream. They do also get involved in hip flexion. Usually the hip flexion will look like this, where you'll kind of see how I'm kicking my leg up in this fashion. That will have adductor implications involved. So if you have tight hip flexors, or the tight rectus femoris, the odds are you're probably also going to have a fairly set of restricted adductors. So what we're going to do right now is aim to get, again, on that inner portion of the thigh right here. The tool of choice, once again, will be the medicine ball. I'm going to be laying down on the ground, turning my leg out, almost like a dog peeing on a fire hydrant. Both my elbows are going to be down here, almost like I'm in a plank, and I'm going to be aiming high towards the groin. These tissues are the ones that seem to always be the ones that have the most impact on people's functionality, especially at their hip joint or even at their knee. This seems to always be the area that helps people the most. Again, this is an intuitive process. Myofascial release is an intuitive process, but the probability is that you'll get the most effect if you focus on this upper region. You want to make sure you don't get too far forward. If you go forward in this direction, you might begin to put pressure on your femoral artery. You don't want to be putting pressure on arteries or even nerves. You want to make sure you're on top of muscles. What you'll feel is a cord, and you want to make sure that you put the pressure directly on top of the cord. So keep the pressure on the cord, centralize the pressure on the cord, and then kind of just work around from there. Now, if you happen to be a person that does have, if you feel like inner knee pain, oftentimes what you'll find is that if you get nice and close to the knee joint itself, the way that I am here, so you guys just saw that I adjusted the ball out there, this oftentimes tends to be a really big hot spot right next to the knee, right where the areas of stabilization happen at the knee. If you use your adductors as isometric stabilizers, which isn't a good thing, but if you do use them that way, at some point you're going to have to probably rehydrate them until you make them not react that way. But yeah, this is an area that you may want to get to. If you do happen to feel like inner knee pain, this generally tends to be a spot that you can get into. But if you really want to get to the root cause of adductor problems, most of the time you're going to want to get to the mid region to the upper regions of that groin when you get into this release. Again, find the points of discomfort. This one varies. Some people tend to feel a lot of pain with this release. Some people don't. Like in general, it's all dependent on the individual. Again, always generally tend to go for that discomfort. Make sure you go through that 2 to 5 minute mark, and that will be that. Let's move on to the next technique.